Okay, and so with an injection, usually I give you one injection, it takes pain from like an 8 down to 3 or 4, see you back in 3 weeks, give you one more, usually it's gone. And then so at this point, I don't want y'all shaking the needle over there and doing that kind of stuff in front of them, because the patient will just be looking at you going, is this a pre-planned treatment? Like, I don't like it that you're about to give me an injection, you haven't talked to me about it yet. And so I really don't want y'all to hand me anything yet, and I don't even want to look over it yet. I'm still having the conversation, so I'm talking to the patient. And good patient care for me is just wait. And so is an injection okay? And then she goes, yes. I'm like, okay. And then I'll go and then once she said okay, you're already ready. You can have it behind your back shaking wherever you want. You have the alcohol pad out. You can have the needle already in place. You can have everything, but just kind of behind you, or not just in front. And so then once you say okay, then I'm gonna go and get the alcohol pad. And so then we go, okay, so now you can already have the alcohol ready. We're gonna do the alcohol pad, okay? And then the gel's already on because it's the ultrasound in there. You can already put the gel on it. And so I'm gonna wipe it down. And then once we're done here, I'm still keeping my eyes on the patient, and I'm just gonna look over and I'm talking to them about plantar fasciitis and treatments. And so then we're gonna, they've already said yes to the injection, so now we don't have to hide or anything because they know it's coming. And so once we get to this point, we'd like the ultrasound to be in front of us, not behind us, because that's hard. So in front of us, and a lot of times I'll point out to the patient what we're seeing. I like them to see what we're doing because they can see how this is benefiting them. And so we get on right where we want to be. And so we need to inject right there. Here's the calcaneus, here's the fascia. And so when y'all get in front of the doctor or whoever's about to get injection, and then you can give me a needle here. I'm not going to actually inject it, and then see how they do that. And then we reach back. I'm keeping my eyes here. I'm grabbing and just pulling off cap. You're going to hold the cap. You already shook it. It's a precipitant, so you have to shake it. Otherwise, it's all the catalog all comes out one glob. So it has to be shaken. So I'm going to assume you already shook it. Pull it, and I'm looking where I want to be here. Okay, and there's where you want to be. And so you got to line the arrow up to where you're going. If I can't see that and I just jab, then we have no idea where it's at. So I've got to see where the arrow is. I got to be 50-50 in the middle of the probe. And so I'm gonna look here, and I'm just gonna hold the needle where I want it, and then if you really, that's okay to start there, but you'd want to be about that far away. If you get too far away, it's too far away. About here, and so I'm gonna hold the needle where I want you to spray it, and then you're kind of spraying it. I'm gonna wait till I think the white right there, and then I'm gonna give you the injection. Okay, and then and so now I'm gonna give you the injection. You can start getting the 4x4 ready because that's gonna be next, and then the Band-Aid ready. That's gonna be next after that. And I'm gonna give an injection, and then once I'm done, I'm gonna keep talking to you because I don't want to turn around. I'm gonna keep talking to you, and I'm gonna use this hand to hand the ultrasound back, and then I'm gonna turn it around. I'm gonna hand this one to this person back here, and we never take the eyes off the patient. And now I'm not gonna poke myself. If you're handling a needle ever, and so once they hand it to you, you should flip it back at yourself. So if I go like this, I'm not gonna poke her like this. And so if I stand up, no real. So when you stand up, if I ever hand you a needle, you should take the needle and point it back at yourself. And then you walk it over, and if Felicia's right there, I kind of go away from Felicia with it, and then you put it in there. You don't ever go like this with the needle and walk like this because you can jab someone. They have this has HIV on it, and I just gave you HIV. You know what I'm saying? AIDS. And so just point it back yourself. You're not gonna poke yourself, and you just go around and you put it in. And so, or a lot of times I'll set it back there. I don't want you to grab it out of my hand while I'm swinging back. Just let me set it down. I don't want to poke you. That's not very safe. So let it drop, and then put it away. So then at this point, so now I injected it, and then you already have a 4x4 lane here because that I got to wipe the gel off. So you've already got a 4x4 lane here. We're still talking about the treatment, and then then we go, and that's see how you tore it in half. And don't try to open it; it's too long, and again we have to fight to get it out. Just tear it in half like that, and then we put the Band-Aid on. And then we talk about it, and then once we're done here, you can roll that. This person here can roll the ultrasound out, clean it really good. And when you leave the room, don't just slam the door, please, because the patient does that, I do that, we're all kind of, that was not local. And so just kind of go out the door and take it to the next room that needs it.